Imagine this, waking up tomorrow with a familiar, confident firmness, not from a pill, pump, or procedure, but from a few minutes of targeted, deliberate touch you give your body. No drugs, no devices, just short, precise stimulation that nudges your natural erection system back into gear. That's the simple idea behind the routine I'll describe. Small intentional actions that improve local circulation, engage pelvic muscles, and sharpen nerve responsiveness, so morning erections become more likely again. I'm Dr. Hannah Kim, a men's sexual health expert. Today, I'll guide you through 3 specific pressure points on and around the penis and pelvis, explain why they work, and give you a safe step-by-step routine you can do daily. If you've been missing that automatic morning rise, this plan will show you exactly where to press, how to press, and how often to practice for real results. Why this helps starts with basic anatomy and physiology. An erection is not random. It's the result of an orchestrated interaction among your brain, spinal cord, nerves, blood vessels, and pelvic muscles. Nerve signals tell smooth muscle inside the penis to relax, allowing blood to fill the corpora cavernosa. As those chambers expand, veins are compressed and blood is trapped, producing rigidity. With age, arterial walls lose elasticity, and nerve conduction can slow. That combination, reduced blood flow plus weaker nerve signals, is a main reason morning erections decline after 50 or 60. Targeted pressure point work stimulates sensory nerves and reflex pathways, sending a wake-up call through the system so arteries dilate, muscles relax, and blood flows more readily into erectile tissue. Some of the points will work also influence pelvic floor muscles, the hammock of muscle under the pelvis that supports the penis and helps control ejaculation. Stimulating these points can improve the tone and reflex responsiveness of those muscles, making it easier both to achieve and to maintain firmness. Think of it as a gentle reset. Repeated properly, this practice can retrain reflexes, improve vascular flexibility, and heighten nerve sensitivity. Location and why it matters. The base groove sits at the root of the penis where the shaft meets the pubic area. To find it, run your fingers along the underside of the shaft toward your body. You'll feel a subtle groove or hinge where the erectile tissue meets the pelvic anchoring structures. Under that skin lies a dense network of sensory nerves and key vascular junctions that feed the erectile chambers. Stimulating this site activates both nerve and circulatory pathways simultaneously, priming the tissue for a stronger response. How to work it? Position your thumb on the base groove while cradling the back of the shaft with your other fingers. Apply steady circular pressure. Not sharp or painful, but firm enough to feel the tissue under your thumb. Move slowly, allowing the warmth of your touch to spread. Start with moderate pressure, and if comfortable, increase gently as the tissue softens. Typical sensations include warmth, mild tingling, or a sense of fullness as blood flow rises. If you don't feel much initially, be patient. Consistency over days and weeks usually brings clearer sensations. Timing and frequency. Aim for about 90 seconds on the base groove once daily. Ideally, in the morning when your body is relaxed or during a warm shower, when heat has already improved blood flow. Daily repetition helps retrain nerve pathways and vascular responsiveness. Location 2. The perineum is the soft pad of tissue between the scrotum and the anus. It lies over the bulbous spongiosus muscle, an important pelvic floor muscle that helps trap blood in the penis during erection. Strong pelvic floor contractions help maintain rigidity and assist with ejaculatory control. Over time, if these muscles weaken, maintaining firmness becomes harder. Stimulating the perineum reflexively activates these muscles and improves their tone. How to work it? Sit or lie back, with knees slightly apart. Use 2 fingers, index and middle, or the base of your palm, to press gently but firmly into the center of the perineum. Use slow, deliberate, circular motions. Pressure should be steady and comfortable, never painful. You may feel warmth spreading toward the penis or a subtle pulsing as blood flow increases. Spend 2 to 3 minutes here, keeping movements controlled combined with pelvic floor exercises. For added benefit, follow perineum massage with a few pelvic floor contractions similar to Kegel. Contract the pelvic floor for 3 to 5 seconds, then relax, repeating several times. These contractions work with the reflex triggered by massage to strengthen the muscle's ability to support erections over time. Location 3, the corona is the ring where the glans meets the shaft. This ridge contains an extremely dense concentration of sensory nerve endings. Stimulating it in a controlled way awakens those nerve pathways and improves signal transmission to the spinal erection centers, making the transition from arousal to full erection smoother. How to work it? Gently grasp the penis near the glans with thumb and forefinger positioned on either side of the corona. Lightly pinch the ridge and hold for about 5 seconds, then release. Repeat this hold and release rhythm for approximately 1 minute. Follow with slow circular motions around the corona for another minute, enough to stimulate without causing friction irritation. Keep pressure moderate and consistent. If the area becomes too sensitive, reduce force and slow the pace. Why moderation matters? This area is very sensitive. Excessive pressure or aggressive rubbing can overwhelm nerve endings and be counterproductive. The objective is gentle reconditioning of nerve responsiveness rather than overstimulation. Combine the 3 points into a short, repeatable practice. Base groove, about 90 seconds of slow circular thumb pressure. Perineum, 2 minutes of steady circular massage. Add pelvic floor contractions if comfortable. Corona, 1 to 2 minutes of pinch and release followed by gentle circles. Perform the full sequence once daily. Morning or warm shower sessions are ideal because heat improves tissue responsiveness. Consistency matters more than intensity. Small daily practice is more effective than occasional aggressive sessions. This is not an overnight fix. Your body needs time to adapt. Many men notice subtle improvements. More warmth in the pelvic area, a small return of morning tombs, or firmer erections within 2 to 4 weeks. More solid, lasting changes commonly develop over several months of consistent practice. Individual responses vary based on baseline vascular health, nerve function, and lifestyle factors. The aim is gradual improvement in nerve sensitivity, vascular flexibility, and muscle support. Keep nails short, filed, and smooth to avoid micro scratches. Wash hands thoroughly before and after. Consider gloves if you prefer an extra barrier. Do not apply pressure to open sores, inflamed tissue, or recently operated areas. If you experience sharp pain, bleeding, persistent swelling, or numbness, stop and consult a clinician. Men on anticoagulant medication or with bleeding disorders should use lighter pressure and check with their doctor first. The methods work on 2 levels. First, they provide an immediate sensory boost to nerves and a local circulatory response that helps initiate an erection. Second, with repetition, they train pelvic reflexes, improve vascular responsiveness, and strengthen muscle support, all of which make erections easier to initiate and maintain over time. Think of it as retraining the body's reflexes through gentle, consistent stimulation. Integrating supportive habits as recommended in the original routine to amplify the effects of pressure point work. Pair it with healthy daily practices. Hydration supports blood volume and circulation. Regular pelvic floor exercises, Kegels, increase muscle tone and endurance. Balanced nutrition and cardiovascular exercise improve vascular health and testosterone balance. Consistent sleep and stress management support hormonal balance and nerve recovery. Some men choose supplements to support circulation and performance. The text reference 2 commonly discussed options. Organic watermelon extract rich in citrine, which supports nitric oxide production and vascular dilation, and an advanced herbal combination that may include tonga ali, fenugreek, nettle, and citrine to support aspects of erections, stamina, testosterone, and prostate health. If you consider supplements, choose reputable brands and consult your physician for safety and interactions. Start daily with short sessions as described. As you become accustomed, you can gradually increase the duration by small increments, but avoid excessive pressure or very long sessions. The goal is steady, gentle conditioning rather than short, intense bursts that risk irritation. If you feel little sensation initially, start gentler and give your tissues time to respond. Overstimulation too early can numb the area. If pain occurs, stop immediately and allow time to heal. Consult a clinician if pain persists. If you have medical conditions, diabetes, recent pelvic surgery, vascular disease, check with your urologist before routine use. If you don't notice any meaningful improvement after a reasonable, consistent trial, several weeks to a few months, if you develop new pain, or if there are signs of vascular or neurological issues, see your urologist for a full assessment. Loss of spontaneous erections can sometimes signal underlying vascular disease that needs evaluation. You don't have to assume fading morning erections are an irreversible part of aging. By learning these 3 pressure points and practicing them carefully each day, you give your nervous system, blood vessels, and pelvic muscles the stimulation they need to function more effectively. This method is drug-free, discreet, and within your control. Be patient, remain consistent, and pair the routine with hydration, pelvic floor training, and healthy lifestyle habits to maximize results. If you try this routine, give it time and track changes. Many men begin to notice improved warmth and more reliable morning tunes within weeks. Continued practice often yields greater, longer-lasting benefits. Use safe techniques, avoid pain, and consult a healthcare provider if you have concerns. With a few minutes a day and steady practice, you can retrain your body and reclaim mornings that feel more confident and natural.